Clinical data from the North American Menopause Society shows that vaginal atrophy affects up to 50% of women after menopause, leading to dryness pain and even infections. Most treatments rely on hormones or medications, but what if your own body already had a natural tool available anytime without side effects? Today, I'll show you what daily masturbation really does to your vaginal health. My name is Dr. Eliza Hart, and I've spent over 15 years helping women navigate the challenges of midlife menopause and intimate health. In my practice, I've seen how silence, misinformation, and stigma keep many women from understanding the full range of options they have to protect their bodies. My mission is simple: to replace confusion with clarity and fear with confidence. For decades, women were told that self-pleasure was shameful, unnecessary, or even harmful after a certain age. As a result, many have ignored one of the most powerful natural tools available to them. The truth is, masturbation after menopause is not only safe, it can be medically beneficial. In this video, we'll explore the scientific evidence, the biological mechanisms, and the practical ways this daily habit can improve your vaginal health. If you care about women's health after 40 and want medical advice that's clear, honest, and science-based, make sure you subscribe and hit the notification bell. And let me know in the comments, type 1, if this topic resonates with you, or type ZO if you'd prefer me to cover something else. Your feedback helps me create the most relevant content for you. 1. The silent physiological changes after menopause. Before we can truly understand why a simple daily habit could matter so much, we need to examine the foundation: what menopause actually does to a woman's body at the cellular and tissue level. This is the starting point most people overlook, and it explains why so many women over 50 suddenly find themselves facing issues they never expected. For many, menopause begins quietly. Hot flashes, night sweats, and mood swings are the symptoms people talk about most, but beneath the surface, far more subtle yet impactful changes are taking place. When estrogen production falls dramatically, the vaginal tissues that once thrived under its influence begin to lose their natural vitality. Estrogen is not only a reproductive hormone, it is a structural hormone maintaining the thickness, elasticity, and hydration of the vaginal walls. Without it, the lining becomes thinner, less flexible, and more fragile. One of the most common consequences is dryness. This is not just a matter of discomfort during intimacy. Vaginal dryness can influence daily life, creating irritation while walking, exercising, or even sitting for long periods. Some women describe it as a constant sense of rawness, while others feel a persistent stinging or burning sensation. These symptoms can progress quietly over time, leading many to believe this is simply an unavoidable part of aging. The truth, however, is that the biology behind these changes is well documented and, importantly, not irreversible. Another overlooked effect of declining estrogen is the reduction in blood circulation to the pelvic region. Healthy circulation ensures that tissues receive oxygen and nutrients, keeping them resilient and sensitive. When circulation diminishes, many women report a loss of responsiveness, as if their bodies no longer react the way they once did. This can be distressing not only physically, but emotionally, creating a sense of disconnection from one's own body. Add to this the weakening of the pelvic floor muscles, which often coincides with hormonal decline. These muscles, responsible for supporting the bladder, uterus, and vagina, gradually lose tone. That is why so many postmenopausal women begin to notice urinary leaks when coughing, laughing, or exercising. While embarrassing, this issue is not a personal failing, but a predictable outcome of physiological shifts. Finally, the decline in natural lubrication and elasticity can make sexual activity painful sometimes, to the point where women withdraw altogether. This has ripple effects beyond the physical body, influencing confidence, relationships, and overall quality of life. When patients sit in my office and tell me often in hushed tones that they feel as if their bodies have betrayed them, I remind them that what they are experiencing is shared by millions of women worldwide. Clinical surveys confirm that nearly half of postmenopausal women suffer from atrophic vaginitis, a condition marked by thinning and inflammation of the vaginal walls. Understanding these changes is the first step. They are not a sentence of decline, but rather a medical reality that can be addressed. When you recognize the biological basis for dryness, fragility, and discomfort, you open the door to practical solutions rooted in science, not shame. And this brings us to the next important question. What role does self-stimulation actually play in confronting these hidden shifts? 2. Masturbation after 50 myths versus medical evidence. For many women, even saying the word masturbation out loud still feels risky, as if curiosity itself could break a rule they were never allowed to question. That cultural chill has consequences. It pushes a medical topic into the shadows where rumors replace facts, and uncertainty keeps women from practices that might help. As a clinician, I want the discussion back under the light of evidence, because fear is a poor substitute for physiology. The first myth claims that self-pleasure after menopause is harmful to tissues or accelerates infections. There is no credible evidence for either claim. Clinically, we see the opposite pattern. Regular sexual activity, including self-stimulation, supports healthier vaginal physiology by improving lubrication, maintaining sensitivity, and reducing microtrauma associated with prolonged dryness. Observational cohorts consistently associate ongoing sexual activity with fewer urinary tract infections, largely because improved lubrication supports a healthier vaginal microbiome and minimizes friction-related irritation at the introitus. A second myth suggests that desire should fade with age, and that persisting interest is somehow abnormal. Large survey datasets, including those analyzed by the North American Menopause Society, show that libido does not simply disappear at the final period. What often changes are physical conditions: thinner epithelium, reduced lubrication, and pelvic floor deconditioning that can make intimacy uncomfortable. When those drivers are addressed, many women report the return of pleasure, comfort, and confidence. Peer-reviewed studies add useful detail. A 2018 paper in the Journal of Sexual Medicine found that postmenopausal women who engaged in self-stimulation more frequently reported fewer symptoms of vaginal dryness and higher sexual satisfaction than those who did not. Additional analyses link regular sexual activity with fewer recurrent urinary tract infections, consistent with the protective role of healthy lubrication and the mechanical clearance that occurs during arousal and orgasm. Though these studies are observational and cannot prove causation, the physiological rationale is coherent and clinically plausible. Another misconception is that masturbation is merely a behavioral choice with no medical relevance. In reality, it functions as a simple, low-risk intervention that promotes blood flow to vulvovaginal tissues, gently stretches the mucosa, and recruits the pelvic floor through rhythmic contractions during orgasm. For some patients, this complements other evidence-based options, such as vaginal moisturizers, lubricants, pelvic floor training, localized estrogen therapy, or DHEA, depending on personal history, contraindications, and preferences. Equally important is the dimension of body literacy. Women who maintain periodic self-stimulation often become more attuned to changes in comfort, discharge, odor, or bleeding signals that can cue earlier evaluation for infection, atrophy, or dermatologic conditions. Far from being trivial, this awareness supports preventive care, reduces delays in treatment, and helps patients articulate symptoms precisely during consultations. Once myths are cleared away, the question becomes practical. What exactly changes inside the body when arousal and orgasm are occurring? And why might those changes matter more after estrogen has declined? Understanding the hemodynamics and tissue responses is the next step, and it sets the stage for discussing circulation without relying on euphemism or apology. 3. Core biological benefits. When we evaluate the intimate health of women after menopause, one of the most striking realities is how much the body still responds to stimulation. Far from being a trivial matter, regular self-pleasure produces measurable biological benefits that extend beyond temporary comfort. Modern clinical research allows us to identify several key mechanisms that explain why stimulation can be protective, even restorative for vaginal health. The first and perhaps most obvious effect is enhanced circulation. During arousal, blood vessels in the pelvic region dilate, allowing oxygen, glucose, and immune cells to reach tissues that would otherwise remain undersupplied. This influx nourishes the vaginal walls, maintains epithelial thickness, and prevents the fragility that contributes to discomfort. A study in Menopause 2019 confirmed that women who remained sexually active showed significantly better vascular response compared with those who were abstinent, reinforcing the idea that circulation itself is therapy. Equally important is glandular activity. Vaginal lubrication depends on secretory glands, and though estrogen decline reduces their baseline output, stimulation provides a biological signal that activates them. Regular arousal leads to more consistent moisture, reducing dryness and lowering the risk of microtears. Women who engage in regular stimulation often describe not only improved intimacy, but also easier daily comfort when sitting, walking, or exercising. Elasticity represents another major benefit. Without use, vaginal walls lose collagen and elastin, becoming stiff and unyielding. Repeated stretching during arousal gently preserves flexibility, preventing atrophy. Histological studies have shown thicker, more resilient epithelium in sexually active post-menopausal women, suggesting that use itself maintains structural integrity. The pelvic floor also responds. During orgasm, the pelvic muscles contract in rhythmic waves, a process nearly identical to Kegel exercises. Each contraction builds tone coordination and endurance, reducing the likelihood of stress incontinence. Research from BJU International demonstrated that women with frequent orgasms reported fewer urinary leaks, highlighting how natural physiology can substitute for mechanical training. Neurochemical changes further extend the benefits. Arousal and orgasm release oxytocin, dopamine, and endorphins. These chemicals reduce anxiety, ease pain, stabilize mood, and promote deeper sleep. For many patients, this is not a minor side effect, but a transformative improvement in quality of life. Sleep becomes restorative, stress levels decline, and resilience increases. Finally, consistent stimulation supports immune health. Adequate circulation and glandular secretion maintain a balanced vaginal microbiome, limiting the overgrowth of harmful bacteria and reducing recurrent urinary tract infections. The presence of natural moisture and the gentle flushing effect of secretions create conditions where protective flora thrive. Taken together, these mechanisms reveal a comprehensive biological rationale. Stimulation enhances circulation, restores lubrication and preserves elasticity, strengthens the pelvic floor, balances hormones, and protects against infection. Rather than a source of shame, it is a practical, evidence-based strategy for maintaining health after menopause. If you have ever noticed changes in circulation, dryness, or pelvic strength after menopause, share your experience in the comments. Your story might help another woman realize she's not alone. By speaking openly, we build a community where silence no longer defines women's health. 4. The most surprising effect. For many years, the medical community approached vaginal atrophy as a permanent outcome of menopause. Once estrogen levels declined, the vaginal epithelium thinned, the collagen scaffolding broke down, and elasticity diminished. Textbooks taught that these changes were inevitable and irreversible, and physicians often repeated this message to patients. Women were advised to accept dryness, fragility, and discomfort as unavoidable, relying on lubricants or hormone therapy only for partial relief. The lingua. New research has altered this narrative. In 2020, a Mayo Clinic study followed postmenopausal women who engaged in regular sexual activity or self-stimulation over a 12-month period. Tissue biopsies and imaging revealed measurable improvements in epithelial thickness, collagen density, and vascularization. The investigators noted that the mucosa showed fewer signs of inflammation, and microtears healed more quickly in women who maintained stimulation. This finding challenged decades of assumptions. The biological mechanisms provide a compelling explanation. Repeated stimulation increases pelvic blood flow, which delivers oxygen and nutrients essential for tissue repair. Mechanical stretching encourages fibroblasts to produce new collagen and elastin fibers, restoring flexibility. Enhanced circulation also supports angiogenesis, the growth of new microvessels, which in turn sustain tissue vitality. Together, these processes demonstrate that vaginal atrophy is not an irreversible state, but a dynamic. One example helps bring the research to life. A woman in her 60s who had avoided intimacy for years due to discomfort began incorporating gentle self-stimulation several times a week. Over months, she noticed less dryness, more comfort during movement, and eventually reported that intimacy with her partner was no longer painful. When compared with peers of the same age who remained inactive, her outcomes were dramatically better. This type of anecdote mirrors the clinical data, showing how biology. What makes these findings so important is not only the physical change, but the psychological impact. Many women describe despair when told that their intimate tissues will only decline. The prospect of renewal restores hope. Patients who once avoided intimacy because of pain begin to reconsider, and those who felt isolated by symptoms discover that their bodies still retain capacity for healing. In clinical practice, this shift changes the conversation. Instead of counseling women only on symptom management, of course, caution is warranted. The Mayo Clinic study involved a modest number of participants, and larger trials are still required to confirm how universal and durable these benefits may be. Not every woman will experience dramatic reversal, and results can vary with health status, lifestyle, and consistency of practice. Yet the evidence already compels us to reconsider the old message of irreversibility. The body remains adaptive, capable of regrowth when given consistent physiologic stimulation. For practitioners, this means shifting language from resignation to possibility. Rather than telling women that atrophy is permanent, we can explain that the process may be slowed, mitigated, or even partly reversed. This reframing empowers patients, giving them agency in their own care. It validates the choice to engage in self-stimulation not as indulgence, but as a clinically relevant intervention. Importantly, it also reduces reliance on costly medications, emphasizing autonomy and self-care as centra. Recognizing that tissues can regain thickness, elasticity, and comfort naturally leads to the practical question of how women can implement these strategies safely in their daily lives. That will be the focus of the next section. 5. Practical guidance for safe practice. Understanding that stimulation can support circulation, lubrication, elasticity, and even tissue renewal naturally leads to the next question: how can it be practiced safely and comfortably? For many postmenopausal women, the hesitation comes not from lack of knowledge about benefits, but from uncertainty about how to begin again after years, or sometimes decades, of avoidance. A structured, compassionate approach can make this process feel less intimidating and far more effective. Frequency and rhythm. There is no single prescription that applies to all women. Some research suggests that stimulation several times per week is enough to maintain vascular health and glandular activity, while others report daily practice provides the greatest comfort. The key is consistency rather than intensity. Even brief sessions, if repeated regularly, can create the physiologic signals needed for tissue repair and lubrication. Women should feel free to experiment with rhythm until they find lubrication and supportive tools. After menopause, natural secretions often decline, so external support can be helpful. Water-based or silicone-based lubricants reduce friction and allow tissues to stretch gently without trauma. Importantly, products should be free of added fragrance, dyes, or harsh chemicals that may irritate the mucosa. For those who prefer devices, small vibrators designed for gentle stimulation can increase blood flow efficiently. These are not mandatory but may be especially used. Hygiene and safety. Maintaining cleanliness is essential. Washing hands thoroughly before and after stimulation. Rinsing devices with mild, unscented soap and storing them in a dry environment prevents infection. Women should avoid sharing devices or using products that create microabrasions. Any persistent irritation, discharge, or bleeding warrants medical evaluation to rule out other causes. By taking these precautions, stimulation remains a safe, low-risk practice. Individual adjustment. Every woman's body responds differently. Some may prefer external stimulation only while others gradually incorporate internal touch as comfort improves. The message is that there is no single correct method. The right approach is the one that feels gentle, non-painful, and sustainable. In counseling, I often remind patients that listening to their bodies is as important as following general guidelines. Pain is not a requirement for progress. On the contrary, discomfort signal, integrating with daily life. For many, creating a private, relaxed environment makes practice easier. A warm bath, soft lighting, or simply setting aside uninterrupted time can help the body respond. Thinking of stimulation as part of self-care like exercise or meditation removes stigma and frames it as a routine act of health maintenance rather than indulgence. Women who embrace this mindset are often the ones who notice the most consistent improvements. Taken together, these principles provide a roadmap, regular gentle practice supported by lubrication, attention to hygiene and personal adjustment. Safe stimulation requires no elaborate equipment or rigid schedule. What matters most is respect for one's body and commitment to consistency. Rather than ending the conversation here, it is helpful to recognize that stimulation works best when it is not treated in isolation. The surrounding lifestyle, nutrition, physical activity, rest, and emotional balance can either reinforce or undermine the progress made. Understanding that wider context is the next step toward building lasting well-being. 6. A holistic lifestyle approach. While regular stimulation offers clear biological benefits, its impact reaches full potential only when combined with supportive daily habits. Menopause is not solely a decline in ovarian hormones. It is an intersection of cardiometabolic change, sleep disruption, and shifts in immune regulation. Aligning nutrition, movement, rest, and stress management with intimate care ensures that the gains from stimulation are reinforced rather than eroded. Nutrition as foundation. Diet directly influences microvascular health and connective tissue quality. Prioritizing omega-3 rich foods, fatty fish, walnuts, flaxseed, supports endothelial function and helps temper low-grade inflammation that can worsen dryness. Fermented foods and fiber nourish the gut microbiome, which has downstream effects on urogenital balance via immune signaling. For many women, modest increases in plant proteins, leafy greens, berries, and mineral-rich foods, magnesium, zinc improve energy and recovery, making it easier to maintain consistent practice. Phytoestrogens and supportive agents. Soy foods, chickpeas, and ground flaxseed provide compounds with mild estrogenic activity that can complement non-hormonal approaches. Some women also benefit from localized moisturizers containing hyaluronic acid or vitamin E. These do not replace stimulation, but can reduce friction and support the mucosal barrier during reconditioning. Adequate hydration, aiming for regular, evenly spaced fluid intake, keeps secretions less viscous and the epithelium more comfortable. Movement and muscular resilience. Exercise improves vascular tone and pelvic stability. Brisk walking, cycling, or swimming enhances circulation to the pelvis, while resistance training maintains muscle and bone. Yoga or Pilates improves posture and diaphragmatic breathing, both of which reduce intra-abdominal pressure that can aggravate leaks. Adding short, properly cued pelvic floor sessions with biofeedback when available can accelerate strength gains established through orgasm-related contractions. Weight, cough, and bowel habits. Even modest weight reduction can lessen stress on the pelvic floor and urethra. Managing chronic cough, treating allergies, and avoiding smoking reduce repetitive strain that undermines continence. Preventing constipation with fiber fluids and movement prevents straining, which otherwise stretches and fatigues supportive ligaments over time. Sleep and stress regulation, consistent sleep schedules, morning light exposure, and limiting late caffeine improve sleep architecture. Gentle stimulation in the evening can augment endorphin and oxytocin release, easing the transition to restorative sleep. Stress reduction practices, paced breathing, brief mindfulness, or slow stretching lower sympathetic overdrive, which otherwise tightens pelvic musculature and narrows blood vessels, counteracting the benefits you are trying to build. Skin and product hygiene. Choose unscented, pH-appropriate cleansers. Avoid douches and fragrance products that disrupt the microbiome. If using devices, clean with mild soap, rinse thoroughly, and let dry completely before storage. Friction should be minimized with water or silicone-based lubricants. Patch test any new product on the forearm to screen for irritants before intimate use. Coordination with medical care. Non-hormonal strategies work alongside, not against, clinical options. Women with bothersome symptoms may still benefit from localized estrogen or DHEA, and those with recurrent infections, dermatologic conditions, or bleeding need evaluation. The point is, agency, lifestyle, and stimulation create a platform that often lowers the dose or frequency of medical interventions required. Seen together, these choices turn a single practice into a stable system. Vessels are more responsive, tissues recover faster, muscles endure longer, and the nervous system settles more easily. By combining stimulation with thoughtful nutrition, regular movement, restorative sleep, and effective stress management, women create not just symptom relief but a sustainable foundation for vitality after menopause. This is the payoff, an integrated path that transforms a private act into a broader strategy for health, dignity, and long-term well-being. Menopause does not mark the end of vitality. It simply marks a new chapter in how women care for themselves. Throughout this discussion, we have seen that stimulation, once shrouded in silence and stigma, is in fact a powerful and natural tool for health. It promotes circulation, restores lubrication, protects elasticity, strengthens the pelvic floor, balances hormones, and even supports immune defense. Research now confirms what many women discover for themselves, that with consistent care, tissues can regain. These truths should transform how we think about aging. Instead of resignation, there is possibility. Instead of decline, there is adaptation. By reframing intimate care as preventive medicine, every woman can reclaim dignity, comfort, and confidence without shame. This is not indulgence. It is science-based self-care that affirms your worth at every stage of life. I want to thank you sincerely for spending this time with me. Your willingness to listen, to learn, and perhaps to rethink long-held assumptions is the first step toward lasting change. If this message resonates with you, please subscribe, leave a comment with your thoughts or questions, and share this video so other women can find the same encouragement. Together, we can replace silence with knowledge and isolation with community.